session. Do I have a second? Senator Carter seconds. We're now in executive session. Up first, we're going to consider, oh, I'm sorry, Madam Secretary, please call the roll.
Senators Coleman, Carter, Arthur, Gannon, Moon, Thompson Raider, Washington.
We're now considering Senate Bill 160, introduced by Senator Schroer, which modifies provisions relating to the public funding of abortion facilities. I make a motion to take up Senate Bill 160. Do I have a second? Senator Thompson Raider seconds. Now 160 is before the committee. I now move to vote Senate Bill 160 out, do pass. Do I have a second? Senator Carter seconds. Is there any discussion? This is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter. Yes. Arthur. Gannon. Moon. Thompson Raider. Washington.
By your vote of 4-1, Senate Bill 160 has passed. We're now considering Senate Bill 173, introduced by Senator Koenig, modifying a sales tax exemption for the sales tax of certain medical devices. I'd like to make a motion to take up Senate Bill 173. Do I have a second? Senator Thompson Raider seconds. Senate Bill 173 is now before the committee. I now move to vote Senate Bill 173 out, do pass. Do I have a second? Senator Carter seconds. Is there any discussion? Seeing none, this is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman. Carter. Arthur. Gannon. Moon. Thompson Raider. Washington.
By your vote of 6-0, Senate Bill 173 passes. We're now considering Senate Bill 228, introduced by myself, which modifies provisions relating to the do-not-resuscitate orders for children. And I'm making a motion to take up Senate Bill 228. Do I have a second? Senator Gannon seconds and is now before the committee. Is there any discussion on the bill? I have a committee substitute that's ending in .02C, which has been distributed in your packets, and move for the adoption of the committee substitute. Do I have a second? Senator Thompson Raider seconds. Real quick, let me explain the substitute. There's just a couple of technical changes, modifying provisions relating to match the previous language. There was a clarification on 190.606, .1, .2, and then also .613. No, you're fine. So my understanding is that that would not negatively impact a parent's ability to seek care for their child at any time. And in fact, that's part of why we're having to have this, is so things like flushing out a trach, which is an emergent situation, but routine care, we want to make sure that kids have access to that care, even if they have a DNR, so that we're not limiting extraordinary care. We are only limiting extraordinary care that the parents have chosen not to receive, not appropriate medical care in emergency situations.
Thank you so much.
Yeah, no problem. All those in favor of adopting the committee substitute, please say aye. Aye. Those opposed, nay. We have adopted the substitute, and I now move to pass Senate Committee substitute for Senate Bill 228 do pass. Do I have a second? Senator Carter seconds. This is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter, Arthur, Gannon, Moon, Thompson Raider, Washington.
By your vote of 6-0, you have voted do pass Senate Committee substitute for Senate Bill 228. We're now moving to consider Senate Bill 229 that I introduced, modifying provisions related to Children's Division contracts, and I make a motion to take up Senate Bill 229. Do I have a second? Senator Carter seconds. Senate Bill 229 is now before the committee. Is there any discussion on the bill? I have a substitute ending in .03C that was distributed in your packets, and move to adopt the committee's substitute. Do I have a second? Senator Carter seconds. Real quick, let me explain that substitute. It takes into account the very appropriate conversations that we had in committee with Senator Carter about wanting to make sure we weren't incentivizing intake of care by a provider who was doing both the investigation and then also managed care contracts. So we are limiting the region, and if somebody is working in one circuit, they can't have both contracts in a circuit. So I appreciate the commentary. I think that that improved the bill. Any other commentary or questions on the substitute? Okay, seeing none. I move to adopt the committee substitute. Do I have a second? Senator Carter seconds. All those in favor of adopting the committee substitute, please say aye. Those opposed, nay. The ayes have it. We've adopted the substitute. I now move to vote Senate committee substitute for Senate Bill 229 do pass. Do I have a second? Senator Carter seconds. This is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter, Arthur, Gannon, Moon, Thompson Raider, Washington. 6-0.
By your vote of 6-0, Senate committee substitute for Senate Bill 229 has passed the committee. We're now considering Senate Bill 204, introduced by Senator Moon, which repeals the certificate of need process. And I make a motion to take up Senate Bill 204. Do I have a second? Senator Thompson Raider seconds. I now move to vote Senate Bill 204 out do pass. Do I have a second? Senator Carter seconds. Is there any discussion? I'll just say I had asked the Senate sponsor to work for a couple weeks to see if there was any movement amongst the parties who were debating. It seems like there are not much ongoing conversations that aren't going to be moved forward at this time, and so we're going to just go ahead and move it out of committee where those conversations can continue as it leads up to the floor. Yes, please.
I just want to say that I'm voting to move it out of committee. I want to hear more discussion on the floor. I want to hear the debate. I think that it's a very important topic, and so I look forward to hearing the full debate. I just didn't want to give the indication that I'm a yes on the floor. I'm an unsure on the floor, and just want to hear more about it. So, but yes, in committee for sure. Thank you.
Thank you, Senator Thompson Raider. I will echo those comments. So I now move to vote Senate Bill 204 out do pass. Do I have a second? Senator Moon seconds. Is there this is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter, Arthur, Gannon,
No.
Moon, Thompson Raider, 4-2.
By your vote of 4-2, Senate Bill 204 is voted out do pass. Last, we're going to consider SJR8, introduced by Senator Eigel, which prohibits expenditures of public funds to any person or facility performing or inducing an abortion. And I make a motion to take up SJR8. Do I have a second? Senator Thompson Raider seconds that SJR8 is now before the committee. I now move to vote out SJR8 do pass. Do I have a second? Senator Gannon, is there any discussion? This is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter, Arthur, Gannon,
Aye.
Moon, Thompson Raider, Washington, 5-1.
By your vote of 5-1, the committee has passed out SJR 8. That concludes our hearing on health and welfare.